Hello friends, you all know that Porbandar gave us Gandhi. Now it's giving us a generation of doctors who must balance ethics with algorithms. Are you ready to lead that change? So I'm thankful to the GMERS Medical College at Porbandar where I talked about AI and machine learning for beginners. The topic was interesting and so was the audience. I have fed this to the AI tool, and as a result, there are two AI avatars who are now speaking to each other about the content that they heard from my session. Go ahead and listen to that. Thank you.
Welcome to the deep dive. We're here to break down complex topics and pull out the knowledge you can actually use. Today, we're getting into something really crucial, especially for anyone starting out in medicine. This whole area of artificial intelligence and, well, how it partners with human intelligence. Our mission really is to cut through the buzzwords, get down to the basics of AI and machine learning, and figure out what skills, maybe non-medical skills, you actually need to, well, thrive as things change.
Exactly. We're trying to strip away the hype. The idea is to give you the essential insights, what this tech can realistically do, and maybe more importantly, why you as a future doctor need to pay attention now. It really boils down to a core principle, I think. Always know why you're doing something, what's the unique value you bring. Because if you can't answer the why, the AI is getting really good at handling the how.
Okay, right. So let's unpack that. Maybe start with the AI itself. But we kind of forget how much it's already around us, don't we? It's not just predictive text.
No, absolutely. Think about systems monitoring industrial kit, spotting tiny anomalies to predict when maintenance is needed before something breaks down, or even financial fraud detection.
Okay, better examples than just like Amazon recommendations.
Well, yeah, and if you look under the hood of any of these systems, whether it's spotting that fraud or, figuring out the best traffic route, it's not really thinking in the human sense. It's doing something more fundamental. Pattern recognition, pattern matching.
Pattern recognition, okay. Sounds simple, but you're saying that's the engine driving all this. It's about classifying stuff.
Precisely. At its heart, machine intelligence draws lines. It says, this pattern looks like a fracture, this marker suggests disease, this data point is normal. It does this classification based on, millions of examples it's learned from, and that lets it process just vast amounts of data incredibly quickly, giving you results or predictions almost instantly. But because it's machine intelligence, it's really, really good only in that binary space, zeros and ones, black and white.
Right, so that leads to the big question, doesn't it?
Yes.
If AI is so good at spotting these patterns, identifying things, does that make human intelligence, HI, less important? Right. Are diagnostic skills heading for the history books?
No, absolutely not. And this is, I think, the key thing for you, the future doctor, to grasp AI, the machine. It gets the binary, speed scale, that's its game. But we live in the gray area. We handle the subjective stuff, the emotion, the context, the ethical knots, things you just can't boil down to data points.
Okay, let me push back there a bit. Couldn't a really sophisticated AI weigh up all the measurable factors in an ethical dilemma and suggest, the statistically best outcome?
Suggest. Maybe. But best. According to what metric? And can it take responsibility? Think about the ER. Not just the simple fracture versus heart attack. Imagine a mass casualty situation. Limited resources, maybe one ventilator left. You have two patients, medically very similar profiles. The data might say patient A has a tiny, maybe 5% better statistical chance of long-term survival. But what if patient B is the mother of 3 kids who were just brought in too? The human doctor has to weigh that up. The immediate impact, the dependence, the quality of life questions, that intense, subjective, emotional, ethical mess. The machine sees probabilities, the human sees the person, and the consequences.
Yeah, that definitely clarifies the stakes. So our unique role is blending that data with judgment, emotion, context, ethics.
Exactly. So for you, the learner, the point isn't to worry that AI will take over diagnosis completely. It's that your success will hinge on getting really good at evaluating the AI's output, putting it into context, and then creating unique insights from it. That's the skill set that keeps the human essential.
That shift from doing the diagnosis to using the diagnosis, that really is disruption, isn't it? Like, think about penicillin. Massive disruption for surgeons back then. Suddenly, infection control wasn't just bad luck, it was part of the job.
Or look at COVID, a huge, undeniable disruption. It wasn't just health. It forced massive changes in Well, everything. Business, education, how we connect, how medicine was delivered virtually, AI and ML, they're bringing that same level of disruption to medicine right now. It demands we adapt.
Okay, let's talk about the machine learning part then. Especially choosing tools. I hear this a lot, new doctors feeling overwhelmed. Which AI do I use? ChatGPT, Grok, Copilot, something else?
Yeah, and that anxiety, it's a bit misplaced. It's not like choosing toothpaste where they're all basically the same.
Yep.
Think of it more like picking a specific surgical tool you like for a procedure you do often. You might have a preference for a certain feel, a certain brand of scalpel or clamp. It's preference-based because the core function is similar across the good ones.
And a really important part is sticking with one, right? That's the core of machine learning.
Absolutely. Consistency is key. If you just dip in and out of different tools, they stay like fancy search engines. But if you commit to one, let's say you use Copilot for all your literature searches or differential diagnosis workups, and you consistently feed it your kind of questions, your specific domain information, then the machine starts to, well, learn you. It learns your style, your specialty, the context you work in. You're actively training it to be a better assistant for you. That ongoing, focused training, that's machine learning in action.
That's a really practical takeaway. You're basically tuning your own tools.
Okay, so we've established AI is great at pattern recognition. Where is that hitting medicine hardest right now? Which clinical roles are changing?
Radiology. That's the obvious starting point, ground zero. Reading an X-ray, an MRI, looking for a crack, a shadow, an anomaly. That is pattern recognition. And because the data, the images are digital, it's relatively easy to train an AI on millions of examples. The machine can often spot the pattern faster, maybe even more accurately sometimes, than the human eye. So the radiologist's job shifts. Less about first-line detection, maybe more about checking the AI's work, interpreting the findings in the patient's context.
Precisely. Quality control, integration, dealing with ambiguous cases. And it's not just radiology. Think pathology. Analyzing digital slides, identifying cell patterns, same principle, or oncology, using patterns in patient data genetics, treatment history, outcomes to predict which therapy might work best for a new patient. AI speed lets us move towards more predictive, personalized treatment instead of just reacting.
Okay, before we get to the human skills needed, maybe we should quickly nail down some core AI terms. The basic building blocks, the sort of anatomy of these systems for our learner.
Good idea. Let's cover 4 key ones. First, the algorithm. Think of it like a recipe, or maybe better, a clinical protocol. It's just a defined set of steps to solve a specific problem or achieve a specific outcome. Step-by-step instructions.
Right, like a protocol for triaging chest pain. Got it. What's next?
The model. This is the actual machine that's been built and trained for a specific task or field. You wouldn't use the same model to read X-rays as you would to analyze ECGs, for instance. They're specialized. An X-ray model knows X-rays, an ECG model knows heart rhythms.
Okay, specialized machine.
Yeah.
And it needs fuel, which is the training data.
Exactly, that's the input. And how you use that data leads to the 2 main training types: supervised versus unsupervised. Unsupervised is like giving the machine a massive library of images or data and saying, okay, find interesting patterns or groups yourself. It's learning from the raw stuff.
And supervised.
That's where the human expert gets involved during training. The data is already labeled, this is a fracture, this is normal, this scan shows a tumor. It's like learning from a textbook, unsupervised, versus learning from a professor who explains the textbook and adds their own experience and context, supervised. That human input, the labeling and curation, adds huge value and makes the model much more accurate for specific tasks. And finally, there's the feedback loop. This is absolutely vital. It's the ongoing process where humans check the model's outputs, correct its mistakes, and feed those corrections back in to keep it accurate over time.
That human checking, correcting errors, labeling the data, that sounds like where the ethics really come into. Which brings us to bias, right? If the training data we feed it is flawed, what happens?
The model learns the flaws. Simple as that. Bias creeps in when your training data isn't representative. If it's mostly data from one demographic, say one ethnicity or socioeconomic group, the model might not work as well for other groups. It just hasn't learned their patterns properly. That's why human oversight and constantly evaluating the source of the data is critical. We have to be the ones to spot and correct for those kinds of systemic inequities reflected in the data.
And speaking of human oversight, there's that famous story, the one that really underscores why we need to stay in control.
Oh, yeah. The Facebook incident. Well, Meta now, where they had 2 AI programs that started talking to each other, but in a language the human researchers couldn't understand the response. They pulled the plug immediately, shut the servers down. It's a stark reminder that we need ethical guardrails, we need transparency, and ultimately humans need to be able to intervene if things go off script or become, well, incomprehensible.
Okay, so let's bring it all together. If AI is mastering the pattern finding, the classification, what's the big shift needed for the future doctor? How do you stay essential, stay the final decision maker? What are the key skills to build?
Right. Three things really stand out, I think. First, you have to cultivate the habit of asking questions. Don't just accept the AI's output. Ask why. Why did it flag this? What data was this conclusion based on? What are the known limitations of this model? Critical thinking, challenging the machine, becomes paramount.
Okay, asking why. Number 2.
Number 2 is becoming data friendly. You've got to get comfortable working with data. I don't mean everyone needs to become a coder necessarily, but you need to understand the basics, how data is structured, what makes data reliable. Start with spreadsheets, sure, Excel, Google Sheets. Maybe get a feel for what tools like Python or R do, even if you don't use them daily. It's about literacy, understanding the language the machine speaks so you can properly evaluate what it's telling you.
Data friendliness. Makes sense. And the third skill.
Collaboration. And this is broad. Collaborating with your human colleagues, obviously. Collaborating with data scientists who might be supporting these tools, but also collaborating with the technology itself, whether that's working alongside a surgical robot, the robo, or just using an AI assistant to help draft notes or summarize research. And remember, using these powerful tools increases your responsibility. The risks can be higher, so that ethical balance, driven by your insight, becomes even more critical.
That's a fantastic roadmap, really. AI gives us incredible speed, efficiency, things we just can't match. But the future belongs to the human professional who layers on that higher level intelligence, the context, the judgment, the uniquely human insights the machine can't replicate.
Exactly. You need to be defined by your context and judgment, not just your ability to calculate or recall facts.
So that brings us to our final thought, something for you, the listener, to really chew on. If pattern recognition is AI's strong suit in medicine, what are the truly human tasks? The emotional heavy lifting, the subjective judgments that specialists make every day. Think about things like delivering a difficult prognosis, navigating complex family dynamics around care, or maybe even the ethics of organ allocation. Which parts of those interactions can genuinely never be digitized? And maybe more importantly, how are you going to intentionally practice and get better at those uniquely human gray area skills?
Start thinking about that now. Focus on those skills. Get data friendly. Pick an AI tool and commit to training it and yourself. And always, always ask why.
Great place to end. That's it for this deep dive. We hope this sparks some useful thinking as you navigate the future.